I would now like to invite our distinguished panelists up to the table. Oh, good, thank you. Yes. First, I'd like to introduce Mr. Stephen Blumberg. He's an executive with AtlantiCare and is responsible for the Accountable Care Organization, which relates to the Affordable Care Act. He has been part of our community since 2012, though he has 25 years of experience with health systems, physician groups, and managed care. Ms. Justine Ceserano is the State Director of Enroll America. Enroll America is a nonpartisan organization whose mission is to maximize the number of uninsured Americans who enroll in health coverage made available by the Affordable Care Act. Mr. Blumberg, would you please comment briefly on some of the changes we may see in our healthcare system?
Sure. Probably the most pronounced thing that you'll see as it pertains to how we're approaching health reform, but really approaching care in general across the community. The most obvious part of that is the expansion of our primary care network and the development of our medical home model. We really believe that the earliest we can intervene and help patients early in a process and guide them to the right setting not only saves future and more significant care, but certainly saves dollars as well. We have numerous examples where early intervention, for example, on our own employee workforce, where we aggressively try to get people to primary care physicians early on and have detected things that would have caused things like surgery and so forth later. At the end of the day, because we've taken this approach, for example, with our employee workforce, we've really seen a reduction in the total amount we spend as well. And at the same time, watching our quality indicators increase. For the Medicare population, which Dr. Torres just referenced regarding our accountable care organization, we have some 12,000 local Medicare recipients who are part of our accountable care organization. And what we do is we assign care coordinators to the sickest amongst that population so that they have a resource who can guide them through the rest of our system and get them to the right resources. So those are a couple of the many tools and programs that we have put forth.
Thank you, Mr. Blumberg. Permit me now to introduce the Honorable Jim Whelan, who's just joined us. Jim Whelan serves in the New Jersey State Senate, where he represents the 2nd Legislative District since 2008. The district covers much of Atlantic County, and he was reelected just last week. So, congratulations.
Thank you.
He has served on our Atlantic City Council and, of course, as mayor of Atlantic City. As a state senator, he serves on numerous Senate committees. Most important for today's discussion, he serves on the Health, Human Services, and Senior Citizens committees. Senator Whelan, please comment upon the potential effect of the ACA on businesses.
I think the effect on business is going to be positive. As we just saw on the slides, it's starting to very slowly, in my opinion, Dr. Torres, and not quick enough, frankly, to bend the cost curve. And if you are in business, large or small, one of your expenses is the healthcare cost of your employees. So as you bend that curve downward, hopefully that provides businesses with opportunities to save some money and invest in capital or hire more people or whatever, give more money to shareholders if they're a large publicly traded corporation, whatever it may be. So from that perspective, I think it's positive. I think the frightening thing that we're experiencing is and the questions that we get in my staff office, how do we sign up? And we see, particularly in the casino industry now, a lot of movement from full-time employees to part-time employees. And some of that is the economy, but clearly when you go to part-time, after a certain amount of time, you lose your benefits, and now all of a sudden you have someone who maybe 3 or 4 months a year they work full-time through the summer season, and then weekends or part-time during the rest of the year, and they are without insurance. So, you know, that's, again, the business is probably saving money under that model, but there's a cost to the rest of us as people go uninsured or move to the model that, you know, some of the things that we saw here. Again, one of the questions we get is how do we sign up? The UAW, one of the casino unions, they have held forums, not just for their members. They've opened it up to anybody who works in the casino or anybody from the public. They hold it in the casino, and they bring the navigators in, and they have a brief presentation, and then you get to sit and talk with the navigator on an individual basis to try to get you signed up if you're in that category where you're a part-time employee and so on. And they invited me to one of those sessions, and we were able to attend, and I think that's very helpful. I think that, you know, it's fairly obvious from the news accounts. People are really scratching their heads over this thing. They're frustrated by the lack of ability to get on the line and to, you know, go to find out what's in the marketplace. And in our particular area, with so many people being part-time, the downturn in the economy, South Jersey, we have the highest unemployment, you know, and higher than North Jersey. There's an awful lot of folks that are very, very scared. There's a second question. The first question is, how do I sign up? And you know, you go to a UAW forum or you try to go online and go through that process. But the second question, and this was covered again by both President Satkamp and Dr. Torres, is why does it all cost so much? These are working people that have just seen themselves, you know, priced out of medical care because now they're part-time, they don't have a plan. Why does it all cost so much? And part of the frustration of that for me as a policymaker, and I suspect for all of us in this room, you put together the statistics that President Satkamp talked about, where we are not doing well. You know, it's a nice theory to say we have the best medical people in the world, and we do. We have the best doctors, we have the best research, we have the best hospitals. We do not have the best outcomes. We are nowhere near the best in the world in terms of life expectancy, infant mortality, preventable death, on and on and on. The list goes, you know, we're not in the top 10 in any of the major categories. The only place where we are number one is in the cost. Dr. Torres cited a figure, I think he said 16%. I've heard higher numbers, frankly, but above 15%, I've heard as high as 20%. Time Magazine did an article in February, I think it was, that cited a figure of 20%. That was the highest I've heard. Most other countries, Canada, our neighbor to the north, Western Europe, Japan, so on and so forth, are between 9 and 12%. So we're paying the most amount of money in terms of the percentage of our gross domestic product, and we're getting the worst outcomes. And again, part of that is the statistic that we just saw from Dr. Torres, so many people uninsured, so on and so forth. I think that one other number that I want to hit you with as to why it's so difficult to make changes in the system, and I've said this before to other groups when we've discussed this. I want the doctors to make a lot of money, okay? I want the smartest kid in the room to go be a doctor because that's who I want to treat me. I don't want the smartest kid in the room to go work for the insurance company. With all respect, anybody here is from the insurance company. Or to work for the medical device company or the other related health fields. I want the doctor to be the smartest guy in the room, and that's where I want the rewards to go. But the reality is that in the last 15 years, at the federal level, the amount of money combined that the medical lobbies, that's hospital associations, that's doctors, that's the insurance companies, that's the people who make medical devices, all those folks, is $5.36 billion. Oil and gas interest and the defense industry combined were 2.8. So you think it's easy to get stuff done. I mean, we all know the military-industrial complex and their lobbyists, and they do this and that, and oil and gas lobbies and so on and so forth. The medical community dwarfs what they do in terms of their lobbying. And I'll give you one specific example. Again, Dr. Torres alluded to when George W. Bush was president, he extended Medicare to prescription drugs. But they put a rider, not a rider in the bill, that what they put in the bill, what the prescription drug companies was able to put into the bill, is that Medicare cannot negotiate with the prescription companies when they buy. So you have this tremendous purchasing power, hundreds of billions of dollars over time, that people who are eligible to buy prescription drugs come all together. You have this great purchasing power. You think you get some reduction. No. They were able to put that into the bill. So as a result, that cost just goes up and up and up. Now, again, the hope for all of us is to let's see the bending of the curve in terms of the increase in that area and in other areas. But the reason that it costs so high is the vested interests that are out there, and some now trying to do everything they can to kill Obamacare before it becomes fully effective, and some who are satisfied with what they were able to get into the bill, like that clause will still stay. Medicare will not be able to go out and purchase in bulk from the pharmaceuticals. So that's part of why we have the most expensive and least efficient medical system in the developed countries in the world. I hope that the Affordable Care Act continues to bend the curve, make it more affordable, make it more responsive. It certainly is a step in the right direction, but I think we have a lot of other steps that we should be taking. And with that, I'll close. Thank you.
Thank you very much, Senator Whelan. And we'll hear from a final panelist, and then we will go to some of your questions that you prepared. Ms. Ceserano, can you please comment upon the potential effect of the ACA on the individual?
Well, I think there are several. Is this working? I think there are several effects that I am very impressed with the ACA and its impact on the individual. I think for the first time for many people, in fact, in New Jersey we have 900,000 people who are uninsured or underinsured, including 350,000 people who will now be eligible for the expansion of Medicaid services. And one of the ways that the ACA will impact those people is that for the first time, those people who have a pre-existing condition will be eligible for affordable insurance that cannot be held against them, nor can their previous medical history or their gender be held against them as well, and it will not impact the cost of their care. I think that in addition, as Dr. Torres said, we now can keep our children, and I for one am very pleased with this as I have a 24-year-old, on our insurance policies until they're 26 years old. I think that's a wonderful thing. In an economy that has taken a downturn over the last couple of years and is slowly just turning around, many of our children who are either in college or who are looking for jobs right now are having a difficult time and have had to take jobs that are either part-time or not quite up to their level of education. What goes along with that is the limited number of benefits that are offered with many of those jobs, and many of those young Americans and young New Jerseyans would be without health insurance previously because of the high cost of insurance. I think those are two of the most important aspects. the fact also that we will now all be able to access an affordable health insurance plan. If our income is 400% or below that of the federal poverty level, we can receive subsidies and assistance with the premiums. This is something that's brand new and I think will help an awful lot of people. And that may not be very meaningful until you start to consider the fact that we're talking about people who are making, an individual who might be making up to $45,000 a year, which wouldn't we all love to get out of college and start at a job at $45,000 a year, or a family of four making upwards of $94,000 a year. So I think there are several impacts that the Affordable Care has made and will make in the future that are just invaluable and will really change the health care in this country.
Thank you very much. We'll now get to some of the questions that you prepared. And though I may direct a question to one of our distinguished panelists, feel free to defer to someone else. Surely every question could be answered. The first question that came from the audience was, and Senator Whelan, what plans are available for someone who has no income? And again, feel free to defer to another member of the panel.
I think Medicaid is probably the first place someone with no income should look. If they're an individual with no income, you know, the Medicaid is designed for people below the federal poverty level. And to the governor's credit, he did not put us in the exchange. I wasn't happy with that part, but I was happy with the part that we at least are participating with the expansion of Medicaid. Some of the Republican governors did not do it, but our governor did. So that's where folks would go. I don't know if Dr. Torres wants to add to that.
That sounds right to me.
Yes, Medicaid.
I'd like to add to that we're very lucky in New Jersey, thanks to Senator Whelan's efforts and many of our legislators, that not only was it expanded in terms of up to 130%, 33% of the poverty level, but also now single adults can qualify for Medicaid, where until that the expansion had been put in place, they were ineligible.
Thank you. Our second question from the audience. Why are we, as a democratic nation, forced to purchase a product such as insurance and certain light bulbs? This would make us socialists, no? Ms. Ceserano.
How about the senator? Just kidding.
Do you want to?
No, we'll take it.
You go first.
Would you like me? Well, I think reality is that we're all responsible for health care and the health status of all of the citizens and those people who are lawfully in this country. Whether or not we're assisting them in providing health care insurance, we are picking up the tab for them when they go to the emergency room and are provided care, which is required by law as well. I think that it's within everyone's interest to have health care that's provided for all of our citizens, because I personally believe that it will lead to a more productive nation. A nation that has a healthier population will have better workers and better learners in our schools, and I believe this is critical to the success of our future as a country.
And you know, to put this in a philosophical context, this can't be a nation of free-for-all, of anarchy. You know, and you go back and, you know, maybe there's some history professors in here, but clearly these were the same arguments used against Social Security back in the 1930s. They were the same arguments used against child labor law. What business is that if, you know, the business owner wants to hire and the family agrees to hire this 10-year-old kid to go to work? You know, we don't do that anymore because there's a collective will and a collective interest of getting that kid in school and, you know, having him go through an educational process before he joins the workforce. There's a collective benefit to having, for our senior citizens, some nest egg for a healthy and prosperous retirement. And you know, you said it very well in terms of the same standards should apply, I think, to health care.
That's great. Thank you. Thank you so much. Dr. Torres, one participant asked, why purchase insurance when it's cheaper to pay the fine?
Well, it is your right. You're in America. If you want to pay the fine, that is fine. Meantime, it's a little bit short-sighted. I think, do you know the average cost of a 3-day hospitalization is around $30,000. So you decide not to buy it, but the day that you fall on your bike, I'm sure you're not going to say, you know, I'm not going to burden the economy. I'm going to stay home and try to heal myself. You're probably going to end up in the hospital. And the thing is that it's a good medicine for you that you're covered, but also it's good for the society that everybody has that peace of mind and coverage, because again, the day that you get sick, the day that you need it the most is when you start having second thoughts. So instead of waiting for that moment, let's make sure that you don't arrive at that moment when you end up at age 26 with a bill that you have to keep paying for 30 years to come. Or 40, they don't have to be 30. That mindset could be at any age, actually.
Great. Thank you. Mr. Blumberg, one participant wrote that they hear about something called bundling of care. What does that mean?
What that means is that you would contract with a payer, and it might be Medicare, to handle a specific kind of treatment or perhaps a disease. For example, one of the programs put forth by Medicare is the bundling of certain orthopedic procedures. And in that model, Medicare would make a single payment for your hospitalization, the surgeon's costs, any rehab costs, and any other ancillary costs. And the organization would administer how to split that payment up. The advantage to the payer is they know exactly what that price is up front. And the incentive to the providers are to provide that care in the most efficient manner possible, because they know what the fixed amount of money is to pay for those services. So there are a number of private insurance companies and Medicare, once again, that are developing programs oriented around bundling care.
So we can anticipate seeing more of that?
I think so. I think that there'll be, in a broader sense, I think what we'll see over time is an ever-increasing amount of financial risk placed on those who are actually doing the provision of care. And bundling is one way to transfer risk from, say, an insurance company to the provider of care for a specific kind of service. More broadly speaking, excuse me, you might see entire populations and providers partner to provide care instead of in a bundle. You would just say they're at risk, and kind of combining the insurance company and the provider in some of those models.
Thank you. Senator Whelan, and again, others could assist. One participant asked, what are student coverage options?
Well, I think the primary option for students, frankly, is to try to stay on their parents' plan if they have one. And now, with it being up to age 26, that will cover graduate school or those who take a little extra time, or maybe left school for a while, or so on. And I think that that's a huge change in the bill and in the Affordable Care Act. I think that's really the primary thing that students should look at. The second, if you're not in a situation where you can be covered by your parents for whatever reason, then the option really is to go to the marketplace and by yourself or with a navigator to try to find out what is out there. The third option is to pay the fine of basically $100 the first year it goes up. I mean, I'm not encouraging that, but that's, you know, an option that someone could say, well, the heck with it, I'm not going to do it. You know, again, if people, if a student is on their own for whatever reason, their, you know, relationship with their parents is not, you know, maybe their parents died, who knows, and they're on their own, they're going to school and there's no income, then you also have the Medicaid option would be applicable as well.
So in a follow-up, colleges often provide or offer health care insurance. Will the Affordable Care Act possibly change that?
I don't believe it does. I think the colleges can still offer the insurance. There was, it was mandatory, and I think it's no longer mandatory that the college has to provide the insurance and that students have to have the insurance. But most of the colleges, I believe, are still, I'm looking at President Satkamp, are still offering it, and many of the students do sign up if they don't have the, you know, the parental help. Oh, it's mandatory for the state colleges, but not the community colleges. I knew we made that change. Okay.
Thank you.
Can I expand on that?
Oh, please do.
For example, you have coverage right now, and you're fine. But if, for example, if you, for any reason, drop in the middle of the semester, then you will become uninsured. And even if it is outside the open enrollment, you will be able, that will be one of the exceptions where you can enroll through the health insurance marketplace. Mm-hmm. Importantly, if you're still a dependent, if your parents have you as a dependent, the parent will have to apply in the marketplace for this son or daughter's insurance. If you're independent, then you can apply yourself.
Good. Thank you. I think this next question is a nice follow-up. The question was, can you change coverage levels mid-year? Ms. Ceserano.
Yeah. No, you.
Yes, you're able to do so, correct?
I think that you have to wait until open enrollment.
It's open enrollment, I'm sorry. You are able to change coverage as you go from year to year. You will remain on whatever plan you've selected throughout the enrollment period. Well, you can also enroll for if there are life-changing exceptions, correct, such as if you've lost your job, and I think that's where I was coming from initially. If you've lost your job, if you have gotten married, if there are certain conditions that are met, and those are all spelled out.
Not married.
Become unmarried through divorce, annulment.
Thank you. Thank you. Question from our participants. Why was I referred to equity.com to confirm my identity when I called the 800 number? Ms. Ceserano or Dr. Torres?
I think that security is paramount for healthcare, for our government, for healthcare.gov, and the only way to verify who you are is to make sure that the information you provide matches a company like that probably is one of those that where you can check your credit report. That means if you don't have other way to prove it, obviously, if you have information with you, but otherwise you will be asked to call that company to confirm, to confirm that you are the person who's applying, to make sure that, again, it's an anti-fraud safety measure. It's another step to protect everyone.
I think we have time for just a few more questions. Let's see now. Mr. Blumberg, we hear about, and you oversee an accountable care organization. Can you tell us what that is?
Glad to, and I'll just pick up on a few points that Dr. Torres had raised in his presentation. There are a number of programs that Medicare has put together, CMS actually has put together, to try new economic and care models in the marketplace. And one of them is our accountable care organizations. In our case, we've deployed ours not just for the Medicare population, but for commercial populations as well. And we currently have 3 different contracts, if you will, inside of our accountable care organization, the largest of which, as I mentioned earlier, is the Medicare program. And what we basically, in the simplest way to describe it is, we agree with a payer to see if we can simultaneously lower the cost of care and demonstrably prove that we are enhancing the quality of the care that is provided. And we agree to a set of measures up front. Medicare has 33 measures. Thank you. And most of the other commercial payers will agree to far fewer but very targeted ones for the population that they are responsible for. And in the describing it as simply as possible, you agree with the payer to, especially with the Medicare program, that you're going to lower those costs, you're going to meet all of those quality criteria, and for doing so, you'll receive an economic incentive, some of the savings in return. And the Medicare program that we participate in is called the Shared Savings Program. The math on that would work pretty simply. If we were going to spend, and these are the kinds of numbers we talk about, if a population of 10,000 Medicare members would spend in a typical year $100 million, and that is the number, that's the real number in our community. If we are able to spend, say, $95 million on that population, we would then get a incentive from Medicare for a portion of that, half of it, $2.5 million. And then we in turn take, as a nonprofit, we in turn take that incentive and we build even more infrastructure to further enhance that same programming. And so accountable care organizations do exactly what the name says. They're accountable, both economically and from a quality perspective for a population that they've agreed to care for.
Well stated. Well stated. Thank you. Senator Whelan, are the Medicare Advantage plans going to be eliminated?
I don't believe so. I'm going to defer to Dr. Torres, but I don't believe so.
No. Simple.
Medicare recipients will not be impacted by the Affordable Care Act.
We have to fill out any kind of forms or register someplace? We don't want to be fined because we don't have our name on the list.
The answer is the Medicare Advantage are not going to be eliminated. You have this open enrollment where you can enroll on Medicare Advantage, or if you are, you can go back to original Medicare or switch plans during the open enrollment, which ends in December 7th.
So
Thank you. Thank you.
Contact somebody before December 7th and tell them what I'm going to do, or is it just a done deal?
If you want to change it and you want to compare, you should call 1-800-Medicare.
I don't want to change anything.
So you don't have to
So
do
you're
anything.
I don't have to write any letters. I don't have to go online.
No.
Thank you. Thank you. Yes. I'm afraid that we won't be able to take individual questions.
I'm saying that too. Sorry, I didn't hear.
I had no out-of-pocket costs, and I got a letter in the mail saying if you want to keep it the same, it will now cost you $149 a month.
So
So it's an impact on me.
yeah, so this is not part of the Affordable Care Act. This is part of the Medicare Part C. And you can, at this time, you have until December 7th to shop around and maybe choose another plan.
Thank you. One final question. How does the Affordable Care Act affect adult dental care? That was touched upon briefly, but it is an important question.
Good question. Only the essential health benefit required only pediatric dental care. That's the only requirement. But again, a plan can offer more and to attract you, and they might offer adult care. So the requirement is only pediatric care.
And the same is also true for vision care.
Thank you. Well, this concludes the formal portion of our forum. However, for those of you who are interested, Mr. Paul Mizgleski, Financial Counseling Service Manager of AtlantiCare, will go into more detail on how you use the exchange website. If you are interested in seeing that up on the big screen, then I ask that you please remain in the room. please remember that exchange counselors will be available to continue to inform people outside at the exchange table until 9 p.m. Thank you all for joining us this evening, and we hope you did find our forum informative.